Imagine you're sitting in a doctor's office, and you just heard the word pancreatic cancer. Your mind races, your heart sinks, and one question keeps ringing: what now? This is a question so many people and their families face every day. But here's the surprising part: there's more we can know about cancer than we ever thought possible. And it's all hidden in our DNA. Today, I'll take you through the fascinating world of genetic testing, and how it's revolutionizing our understanding of pancreatic cancer. We'll uncover why genes matter so much in cancer treatment, and how one simple test could open the door to treatment options designed specifically for you or someone you love. So stick around, because this information could change the way we face cancer. Section 1: Why genetic testing matters in pancreatic cancer. Genetic testing can feel intimidating, but let's break it down. Imagine your DNA as a blueprint for a building, your body. Sometimes, parts of this blueprint go wrong, creating mutations in our cells. These mutations can sometimes lead to cancer, including pancreatic cancer. Here's where genetic testing comes in. It looks for specific mutations that may have caused the cancer or may influence how it reacts to treatments. By identifying these mutations, doctors can develop a more tailored approach, designed just for you. Think of it like finding a custom-made map to navigate an unfamiliar place. Genetic testing can also provide insights for family members. If someone in your family has pancreatic cancer, there's a chance the same mutation could affect you. Identifying it early can offer you preventive steps, potentially giving you a head start on avoiding cancer altogether. Section 2: Two types of genetic testing, what you need to know. When it comes to pancreatic cancer, doctors and genetic counselors usually focus on two main types of genetic testing: germline testing and somatic testing. Germline testing. Let's start with germline testing. Germline testing is about looking for inherited mutations, those that are passed down from your parents. Imagine you inherited a family heirloom that has a crack. Over time, this crack becomes a weakness that impacts you. In a similar way, germline mutations can be inherited traits that increase your risk of pancreatic cancer. This test looks at genes like BRCA1 and BRCA2, genes often linked with breast and ovarian cancers but also connected to pancreatic cancer. Other genes, like MLH1, TP53, and PALB2, play a role too. If you have one of these mutations, you're not alone. These mutations are fairly common and can also increase the risk for cancers like prostate or colorectal cancer. If a family member tests positive for one of these mutations, you may want to consider germline testing, as it could help you take steps to reduce your own cancer risk. Somatic testing. Next up is somatic testing. Unlike germline testing, somatic testing is all about the tumor itself. Think of it like a personalized investigation into the cancer to see what makes it tick. Somatic testing focuses on the mutations that have developed within the tumor as it grew. By analyzing the tumor's DNA, doctors can discover which genes have changed and how that might affect treatment. This is crucial because certain therapies work better for tumors with specific mutations. For example, some tumors respond best to PARP inhibitors, medications that target DNA repair mechanisms. Tumors with BRCA or PALB2 mutations often respond well to these treatments, making somatic testing invaluable for deciding on the best approach. Section 3: How genetic testing helps tailor your treatment. So, you might be wondering, how exactly does knowing my genetic makeup change my treatment? Think of genetic testing as unlocking a unique code for treatment. 1. Targeted treatments. If you test positive for certain mutations, you might be eligible for targeted therapies. Imagine cancer treatment like a lock and key. The mutation is the lock, and the targeted therapy is the key that fits perfectly. 2. Personalized chemotherapy. For example, research shows that platinum-based chemotherapy could be highly effective for patients with mutations in DNA repair genes like BRCA1, BRCA2, or PALB2. Instead of a one-size-fits-all approach, genetic testing allows for a tailored treatment that aligns with your unique genetic makeup. 3. Exploring new treatment options. Scientists are always on the hunt for new treatment options. For instance, there are promising therapies like larotrectinib or entrectinib for patients with certain tumor mutations. When these genetic links are identified, it opens the door to experimental treatments or clinical trials that could bring more effective solutions. Section 4. What to expect from the testing process. Let's break down what happens when you decide to go forward with genetic testing. It's simpler than you might think. For germline testing 1. Your doctor or genetic counselor will start by going over your family history to determine if germline testing makes sense for you. 2. If so, they'll likely draw a small blood sample. This sample goes to a lab, where it's tested for mutations linked to pancreatic cancer. 3. Once the results are ready, your doctor or a genetic counselor will help interpret what they mean for you and possibly your family. If the results are positive, they might even recommend your relatives get tested too, a process called cascade testing. For somatic testing 1. If you've been diagnosed with pancreatic cancer, your doctor might take a sample of the tumor itself. This can sometimes involve endoscopic surgery, where a small incision is made to collect the sample. 2. This sample is sent to a lab for sequencing, where scientists search for mutations specific to the tumor. 3. Your doctor will then receive a report detailing which mutations are present and which therapies are most likely to work against them. Section 5. Financial and legal considerations. Genetic testing has a cost. But many health insurance plans cover the testing if certain conditions are met, like a strong family history of pancreatic cancer. You may need to contact your insurance provider to find out what is covered. One important point: U.S. federal law protects you from health insurance discrimination based on your genetic test results. However, it doesn't prevent life insurance or long-term care providers from considering these results when setting rates or determining coverage, which is something to keep in mind if you're considering genetic testing. Section 6. What to do if you're considering genetic testing. If you're thinking about genetic testing, the best first step is to talk with a healthcare provider or a genetic counselor. They can help you assess whether testing is right for you based on your family and personal medical history. If you have a family history of pancreatic cancer, they might suggest germline testing to assess your risk. If you've been diagnosed with pancreatic cancer, they might recommend somatic testing to personalize your treatment. Genetic testing is a powerful tool, but it's not the end-all. It's one piece of a much bigger puzzle. Whether you decide to go forward with testing or not, it's essential to have a support system in place: family, friends, and healthcare professionals who can help guide you along the way. Conclusion: understanding pancreatic cancer and your risk is about more than just today, it's about the future. Genetic testing is like unlocking a treasure map that can guide you to more informed decisions, helping you face pancreatic cancer with as much knowledge and power as possible. Remember, you don't have to navigate this journey alone. Your DNA has a lot to say, and so do the people who care about you. So take that first step, learn what you can, and find the peace of mind that comes from knowing more about what lies ahead.